Thank you so much for talking to me this afternoon about your breast cancer experience. I think it will be really useful for other women who may be undergoing similar experiences to share some of the things that happened to you and some of the things which you think might have benefited you if they were done slightly differently. So if you don't mind, I think it would be really, really helpful if you could just take us through your personal journey.
Okay, so when I was diagnosed with breast cancer, the cancer was hormone receptor positive. And so right at the very beginning, the breast surgeon gave me a prescription for tamoxifen. When I started taking that straight away and developed symptoms, gynae symptoms straight away because of the estrogen deprivation. And when I went back to, and this was before I'd even had any treatment at all for the cancer, even surgery. So I went back to see the breast surgeon about 9 or 10 days later to discuss the surgery and mentioned to him the problems that I'd started to have because of the tamoxifen. But he wasn't able to give me any help with that at all. And I felt it was just dismissed, really. It was something that at that point in time didn't really matter. And that's how I felt. I was made. That's the outcome of the way he answered my question, was that this isn't an issue at the moment. It really doesn't matter. A few weeks later, after my surgery, I got in touch with the breast cancer nurse at the breast team and asked her about it. I'd been doing my own little bit of searching around on the internet. And one of the things I'd found out was that there are samples of products that the breast cancer nurses can give you to try and ease some of the symptoms. So I'd spoken to her and asked her about that, and she came back to me and said that, we don't have anything like that here. Go and see your GP. So at that point in time, I'd had surgery, I was waiting to start chemotherapy, I'd had 2 lots of surgery, and when I look back, I think I'd developed things like cording from having axillary lymph nodes removed. And I know that as soon as I mentioned to the breast nurse I've got a problem with cording in my arm, she just referred me straight away to the physio.
Yeah.
And in comparison, when I was raising gynaecological problems, they were just going absolutely nowhere at all. So it was about 3 months later, I went to see my GP, who gave me some replans.
Yeah.
So I had some moisturising treatment, but nothing for the skin, to protect my skin and to make me more comfortable. And I actually didn't get anything for that for over 2 years. And that was just completely random because I was at Liverpool Women's Hospital for something different.
Yeah.
And while the nurse was examining me, she said the golden words, which I've never forgotten: "Does your skin tear?" And that opened it all up for me, that somebody recognised that this was a real problem and that there was an answer to it. It wasn't something I just had to live with.
Can I ask you just to describe what gynecological problems you were experiencing, just for other women to know what you had?
So I had dryness, total, complete dryness, just no moisture at all, and no lubrication when lubrication was needed. And then my skin seemed to become just very poor quality, very thin, quite inflexible, and my skin would tear at the slightest contact. Sometimes even at 2 years, it wasn't as bad as it was at 4 years, because obviously it got a lot worse. In the end, then just maintaining personal hygiene after using the loo, just the tissue paper would tear the skin all the time. So I permanently had torn skin.
And did that start, do you think, as soon as you started the tamoxifen, that tissue fragility?
Well, what happened as soon as I started the tamoxifen was the dryness and the soreness and the tearing. I suppose in terms of the tearing, it would take less to tear the skin as time went by. So the forces that were required to tear the skin initially, I suppose you would say, were quite substantial. That wasn't just when I used tissue paper or was moving around. But ultimately, that's where I got to.
And your first 2 operations, were they to, one, biopsy the tumour and then remove it or remove your breast? What operations did you have before your chemotherapy?
So first of all, I had a mastectomy,
Mm-hmm.
and then I had an axillary clearance.
Okay, on 2 separate operations.
2 separate, yeah. Then I had the chemotherapy, the radiotherapy, and then a good time later, maybe 9 or 10 months later, I had my ovaries removed.
And was that recommended, or was that personal choice because of the ovarian cancer?
It was mostly personal choice, probably, because I had a belief that if I had my ovaries removed, there would be a reduction in risk of recurrence.
Yeah, no, I think that's right. And did you then go on to have reconstructive surgery at a later date?
So I had reconstructive surgery quite a lot later. It was 5 years later. And that was, again, my personal choice. I could have done that sooner, a lot sooner, but I just wasn't sure. So I waited a long time.
And you changed from tamoxifen to a different type of drug. Is it letrozole that you took?
Yeah.
Or you're taking now?
I am now, yeah.
Did that occur around the same time as your reconstructive surgery?
No. So taking letrozole, I started that after I had my ovaries removed.
Okay, so 9
yeah.
months after you completed the chemotherapy and the radiotherapy.
Yes,
Yeah.
yeah. And I think the reason for that was because had I been postmenopausal at the very start of my breast cancer journey, I would have gone straight onto an aromatase inhibitor, but I wasn't. So that's why I started on tamoxifen. And then after my ovaries were removed, I changed over to letrozole.
And did you notice that the dryness and tearing became worse when you changed from tamoxifen to letrozole?
I can't honestly say so, no.
Because I think for other women, it's important just to make the point that for some women on tamoxifen, vaginal dryness is not a problem.
Okay.
But with aromatase inhibitors, because the way in which they work, the estrogen conversion in peripheral tissues is much more extreme. And for you personally, having had your ovaries removed and letrozole, I would imagine that you had pretty much next to no estrogen at all. So I think, and obviously, all the things that happened to you were to ensure that your risk of recurrence were absolutely minimised, and that's really, really important. But there were things, I think, from the outset, as you said, that would have improved things for you, the barrier creams, moisturisers.
Yeah.
And then obviously what I kind of wanted to also focus on was the option of laser therapy, which is a non-hormonal treatment for women who have urogenital atrophy in association with treatments for breast cancer. And some patients who've had breast cancer can have hormone therapy because it's very localized, but many women, and I think you probably felt like this yourself, correct me if I'm wrong, but a great fear of hormones because you know that your breast cancer was triggered by the effect of hormones. So I think one of the things I kind of wanted to pull out here, and you've talked a little bit about it, but what you would change in breast cancer services if you were able to do that?
So for me, what would have been really, really helpful at the beginning was if this issue was acknowledged. So I had raised it at the beginning, but it wasn't really acknowledged, and there was certainly not any support with the issue. So it would have been really nice for me if when I raised that issue, either the breast cancer nurse or the surgeon had said to me, yes, it is a problem, and we have links with our gynaecology service. We'll ask the specialist nurse to give you a ring and you can pop and see her or something like that. But even better than that, if when you, because particularly thinking about your annual review at breast cancer clinic, when they're checking lots of different things and how you're coping with this, that and the other, nobody ever mentions gynae problems.
Yeah.
And it would be really nice if somebody did say, For some ladies, this is a problem. Is it a problem for you? Because if it is, let us know, and we can put you in touch with some support.
And were there any patient groups where you were able to get support?
No, I didn't use. Let me think. I didn't use any patient support group at any of any hospitals, because obviously there's the breast cancer hospital and then there's the Christie for chemotherapy. I did use breast cancer care for support and for advice when I was trying to decide which surgery to have, and then again when I was trying to decide which reconstruction to have. They have something called Someone Like Me, and they'll put you in touch with somebody who's had the very type of reconstruction that you're thinking of having, for example, and you can have a chat on the phone. It's really good.
Isn't it? That's really good.
So fantastic.
If something like that was to be developed for women who have changes in tissue quality because of lack of estrogen, that would be a really positive outcome just from what's happened to you.
Yeah. So, there are a lot of ladies out there who are having these problems, probably with nobody to talk to about them. And that's really sad because it has a huge impact on your quality of life. Yeah. It's very distressing.
Yeah, well, I think would be to link in with the breast care nurses and support them. And certainly at our local breast cancer unit, the nurses have done menopause training. And this would be a big part of what they could do really well, I think.
That'd be good.
Yeah. So thank you so much. I think we've covered everything that I wanted to cover. Was there anything else you wanted to say? Great. Well, thank you. And I hope things improve.
Thank you, Paula.